Isolaz for acne. So what is Isolaz? It's intense pulse light, or IPL, plus pneumatic suction, which gives us the term photopneumatic therapy, or PPX. What is IPL? It's a bright light, high energy over a brief period of time. This slide represents various colors we might see in the skin. On the right is a hair follicle, which has melanin, a type of pigment in it, and it gives us color, gives it the color of your hair. The green dots are actually representing brown spots, which would be melanin. The IPL, and it destroys them. In the case of the hair follicle, we might see hair removal or hair reduction. For the pigment, we might see lightening of the brown spots in the skin. And for the blood vessels, we may see improvement of the redness of the skin. So IPL is used for redness, brown spots, tiny blood vessels, enlarged pores, and even hair removal. But what about acne? IPL alone had limited usefulness, but suction with IPL, it works very well. So what is acne? Well, acne really originates at the hair follicle, and this is called the Pilosebaceous Unit, or the hair follicle. We have the hair shaft coming out of the skin surface, sebum produced by the sebaceous gland, and the follicle which grows the hair. The sebum lubricates the hair follicle so can it exit. Now you might not think you have much hair on your face where you're growing acne, but you do. They can be very tiny little peach fuzz hairs, but these are the structures that cause acne. So again, here's an example of the Pilosebaceous unit. We have hormones and genetics that determine how much sebum we're going to grow, which gives us increased oil production. Then the skin plugs up the relief or the exit of the sebum. This leads to enlarging of the pores, bacteria growth, inflammation. We start getting a whitehead when the exit is blocked off, and as we get the bacteria and inflammation, we get the zit that can be manifested as inflammatory acne or cystic acne. So Isolaz works by using a strong suction that pulls the sebum out of the Pilosebaceous unit, and now the gland itself, as well as the hair follicle, is exposed. And intense pulse light can work very effectively at damaging the hair follicle, the sebaceous cells, and killing the bacteria. So what's happening? The suction pulls out the comedo, the white stuff, out of the follicle. The IPL burns the bacteria. The IPL burns the follicle from the inside. And we have less ability to make oil and make more acne. 4 treatments are usually done at 1-week intervals, but the timing doesn't matter. You can never do it every 2 or 3 weeks, but consider that you would likely need 4 treatments for more moderate to severe acne. And clearance should last an average of 4 months, and then you might be doing maintenance, doing 1 treatment every few months or so. What kind of success we see? Well, the average patient done in clinical studies saw a 30 to 50% improvement after 1 treatment, and a 70 to 90% improvement after 4 treatments. Here's a young man with mild to moderate inflammatory acne, and this is after 2 Isolaz treatments. Here's a young man with more severe acne, and here he's after 4 treatments. In addition to Isolaz, he had what's called photodynamic therapy, which is still using the Isolaz device, but we put a medication on the skin about an hour before the procedure, and it works even more effectively. So it's for mild to severe acne. We'll do treatment and maintenance, 4 treatments typically, and then maintenance every 4 months or so. And use in combination with other treatments, such as topicals and medications. Those are still appropriate to use. What are the risks? Well, if you overtreat somebody, we're using something that burns things, you could have a burn. It's usually minor and self-limited, but it can lead to darkening or lightening of the skin, which would be rare and typically temporary. Undertreatment won't work effectively, so we have to strike a balance between undertreatment and overtreatment.